Hello students, this video is my continuation of my previous video on nerves of the pelvis, and in my previous video I talked about the sacral plexus, which are the nerves which are involved in the formation of this plexus, where it is formed. So please go through my previous video for this. In my previous video I also mentioned that there are 5 major peripheral nerves derived from the sacral plexus. I mentioned the names of these nerves in my previous video. I'll proceed further in this video. So which were the 5 major peripheral nerves? The superior gluteal nerve, the inferior gluteal nerve, the sciatic nerve, the posterior femoral cutaneous nerve, and the pudendal nerve. These nerves you have to remember by heart, the names of these nerves. So we have seen here, this is the sacral plexus, this is the superior inferior gluteal nerves, this is the largest nerve, that is the sciatic nerve, posterior cutaneous nerve of the thigh, and the pudendal nerve. So these are the major peripheral nerves. Now we'll proceed further. There are also presence of small numerous branches which supplies the pelvic floor, pelvic walls, and individual muscles of the gluteal region. So besides these major peripheral nerves, there are also presence of small, very numerous and small branches of nerves, which supplies the pelvic floor, pelvic walls. Pelvic floor means it consists mainly of muscles. Pelvic walls, anterior wall, lateral walls, posterior walls, and individual muscles of the gluteal region. So the muscles of the gluteal region you all know. Now these nerves from the sacral plexus, they descend down the posterior pelvic wall and has 3 possible courses. Now these nerves, all these nerves, they will descend down the posterior pelvic wall and has 3 possible courses. Now what is the course of these nerves? Once it arises from the plexus, what is the course of this nerve? So there are 3 possible courses which is there. We'll see which is the first course of nerves. They will leave the pelvis by means of greater sciatic foramen and enter the gluteal region of the lower limb, either above or below the piriformis muscle. Now you all know what is greater sciatic foramen. The greater sciatic foramen is what? The greater sciatic notch is converted into the greater sciatic foramen and the lesser sciatic foramen by the ligaments of the pelvis. Which are the ligaments? The sacro-tuberous ligament and the sacro-spinous ligament. So if you see this, this is the greater and lesser sciatic foramen. So this is here is the sacral plexus. So the nerves will arise. Here is the piriformis muscle, which you all know. So this greater sciatic notch is divided into the greater sciatic foramina. See, this is the greater sciatic foramina. And this is the lesser sciatic foramina. So this is the greater sciatic foramina. You can see this is the greater sciatic foramina and this is the lesser sciatic foramina. And the ligaments are the sacro-tuberous ligaments. So this is the sacro-tuberous. From the sacrum to the ischial tuberosity. So these are the sacro-tuberous ligament and the sacro-spinous ligament. So you can see here, from the sacrum to the ischial tuberosity is the sacro-tuberous ligament, and from the sacrum to the ischial spine is the sacro-spinous ligament. So this ligaments, it converts the greater sciatic notch into greater and lesser sciatic foramina. Which are the ligaments? The sacro-tuberous ligament from the sacrum to the ischial tuberosity and the sacro-spinous ligament, that is from the sacrum to the ischial spine. So this is the greater sciatic foramen. This is the foramen and this is the lesser sciatic foramen here. So this is the lesser sciatic foramen here. Clear? So this is greater, this is lesser sciatic foramina. So now these nerves, which are the branches as well as the peripheral nerves, they leave the pelvis by means of the greater sciatic foramina and enter the gluteal region of the lower limb, either above or below the piriformis muscle. So here is the greater sciatic foramina. So the sacral plexus, the branches will arise from here and it will go back into the gluteal region. You know, gluteal region is in the back area. So it will go turn around and go into the back, the gluteal region, either from above the piriformis or below the piriformis. You know, here is the piriformis muscle, okay, which I have shown many times in my previous videos. So it is going above the piriformis or below the piriformis. So one course of the nerve is they will leave the pelvis by going through the greater sciatic foramina and they will enter the gluteal region posteriorly, okay, above the piriformis or below the piriformis muscle. Okay, so this is the first course. Now I'll go to the next course. Within the pelvis, and they will within the pelvis, okay, and to innervate pelvic muscles, organs and the perineum. So they will remain in the pelvis, okay, and they will innervate the pelvic muscles, the organs of the pelvis and the perineum, okay. So they will remain in the pelvis only, okay, and they will supply the pelvic organs, the pelvic muscles and the perineum. The next is they leave via the greater sciatic foramina. So the nerves will leave via the greater sciatic foramina, loop around the sacrospinous ligament and enters via the lesser sciatic foramina to supply the lateral pelvic structures and the perineal structures. Okay, so what they will do? The next course would be, what is the next course? The next course is the nerves, okay. The nerves will leave, okay. They will leave via the greater sciatic foramina. They leave via the greater sciatic foramina. They will loop around, okay. They will loop around the sacrospinous ligament. So this is the sacrospinous ligament. Yes, this is the sacrospinous ligament. Okay, this is the sacrospinous ligament. You can see here, this is the sacrospinous ligament. Okay, so they will loop around the sacrospinous from the sacrum to the ischial spines. So they will leave the greater sciatic foramina, loop around the sacrospinous ligament, okay, and they will enter the lesser sciatic foramina to supply the structures from the lateral pelvic walls and the perineal structures. Okay, so what is the root? The nerves will arise from the sacral plexus, okay, the nerves which are arising from the sacral plexus, they will enter the greater sciatic foramina, they will leave the greater sciatic foramina and go to the gluteal region. Okay, this is above the piriformis or below the piriformis. The next course is they remain in the pelvic area and they will supply the pelvic muscles, the pelvic organs and the perineum. And the last course is from the greater sciatic foramina, they loop around the sacrospinous ligament from the sacrum to the ischial spine and they will enter the lesser sciatic foramina. This is the lesser sciatic foramina. You can see here. Okay, this is the lesser sciatic foramina. They will enter the lesser sciatic foramina by looping over the sacrospinous ligament and they will supply the lateral pelvic structures and the perineal structure. Okay, so these are the courses of the nerves arising from the pelvis or the sacral plexus. Now, the most of the nerves takes the first route leaving the pelvis. So first route is what? The nerves arising, growing to this greater sciatic foramina, then going posterior to the gluteal region above or below the piriformis. So most of the nerves takes this course. Okay. Now we'll describe the major nerves. Now, the first nerve is the superior gluteal nerve. The first nerve is the superior gluteal nerve. The nerve root is L4, L5 and S1. Okay. So, superior gluteal nerve, the nerve root is L4, L5 and S1. This you have to remember. So, if I show you in this diagram, this is the superior gluteal nerve. The nerve root is L4, L5 and S1. So, L4 to S1, the posterior divisions, L4, L5, S1. This is the nerve roots of superior gluteal nerve. Okay. So, this is the nerve root of the superior gluteal nerve. Okay. So, here also we can see L4, L5 and S1. So, here is the superior gluteal nerve. You can see here from L4, L5 and the S1. Here is the superior gluteal nerve. Okay, so this is the nerve root. It leaves the pelvis via the greater sciatic foramen and enter the gluteal region superiorly to the piriformis muscle. So it will take the first course. Yes. So this superior gluteal nerve will leave the pelvis and it goes posteriorly to the gluteal region via the greater sciatic foramen. What is greater sciatic foramen? I have already explained. And it will enter the gluteal region above the piriformis muscle. Okay, so that is the course of superior gluteal nerve. So if it is arising, see L4, L5 and S1, okay, it will reach the greater sciatic foramina and it will go posteriorly to the gluteal region, okay, via this foramina above the piriformis, superiorly to the piriformis. Okay, so this is the course of superior gluteal nerve. It is accompanied by the superior gluteal artery and vein along its course. Now, about the superior gluteal artery, I have mentioned in detail when I described the blood vessels of the pelvis. Okay, so what it is said, the superior gluteal artery. It is a continuation of the internal iliac artery. Okay, it is a continuation of the posterior trunk of the internal iliac artery. It ends in the superior gluteal artery and it is accompanied by vein along its course. Function. What is the function of the superior gluteal nerve? Motor function, it innervates gluteus minimus, gluteus medius and tensor fascia lata. So these nerves, these muscles are innervated by this nerve. So you can see here, these are the muscles. Okay, so these are the muscles which are innervated by the superior gluteal nerve. Which are the muscles? Gluteus minimus and gluteus medius. Okay, in the gluteal area. So you can see gluteus medius. You know this. Where is gluteus medius? Gluteus minimus. Okay, this is gluteus maximus. Okay, so gluteus maximus is supplied by the other nerve, but superior gluteal nerve, it supplies gluteus minimus and gluteus medius muscle. Please remember this. Superior gluteal nerve innervates gluteus minimus and gluteus medius. Okay, and it also innervates the tensor fascia lata. Now we'll talk about the inferior gluteal nerve. The nerve roots are L5, S1 and S2. Okay. So if you see this, this is the inferior gluteal nerve. The nerve roots are L5, S1 and S2. So this forms inferior gluteal nerve. Superior gluteal nerve was L4, L5 and S1. Inferior gluteal nerve is L5, S1, S2. Remember this nerve roots for MCQ as well as for Viva purposes. Okay. Now we'll go to the course of the inferior gluteal nerve. It leaves the pelvis via the greater sciatic foramina, entering the gluteal region inferiorly to the piriformis muscle. So the only difference is the superior gluteal nerve was leaving superiorly to the piriformis and inferior gluteal nerve is leaving inferiorly to the piriformis muscle. So it will This is the greater sciatic foramina. The nerves arise, inferior gluteal nerve. It will go to the greater sciatic foramina and it will go posteriorly to the gluteal region, inferiorly to the piriformis. Superiorly is the superior gluteal nerve. Inferior to the piriformis is the inferior gluteal nerve. Clear? So this is the course of the nerves. So superior gluteal nerve, you can see here, and inferior gluteal nerve. And the roots are, inferior is L5, S1 and S2. Clear? Now we'll proceed further. This is accompanied by the inferior gluteal artery and vein along its course. About the inferior gluteal artery, I have already mentioned in my video on blood vessels of the pelvis. Now what is the function of the inferior gluteal nerve? Innervates the gluteus maximus muscle. So this gluteus maximus muscle, okay, this is gluteal maximus muscle, is innervated by inferior gluteal nerve, and gluteus medius and minimus is supplied by the superior gluteal nerve. Please remember this. Okay. Now I'll go to the next nerve. This is the sciatic nerve. Okay. Now it is the largest nerve of the body. It is derived from L4 to S3. Okay. It is derived from L4 to S3. So from L4 to S3 is your sciatic nerve. Okay. From L4, L5, you can see L4, L5, S1, S2 and S3. So this is your sciatic nerve. You can see here, this is your sciatic nerve. Yes. So it is, see this border, L4. Then comes the L5. Okay. Then S1, S2 and the S3. Okay. You can see the outer boundaries. Okay. This is the sciatic nerve, students. Sciatic nerve, this is big. So you can see this is, okay, this is coming, this is L4, okay, L4 and up to S3. Okay, so from L4 to S3 is the nerve root of the sciatic nerve. It has two components. Sciatic nerve has two components. Which are the two components? Common fibular component and common tibial component. The fibular component is formed from the dorsal division of L4 to S2 and tibial component is formed from the ventral division of L4 to S3. So this you have to remember. So sciatic nerve, the division is L4. The nerve root is L4 to S3. It has two components, the fibular component and the tibial component. The fibular component is formed from the dorsal division. Okay, that is the posterior division of L4 to S2, and the common tibial component is formed from the ventral division of L4 to S3. So this has to be remembered. Now we'll proceed further. The sciatic nerve is formed on the anterior aspect of the piriformis muscle, and it exits the pelvis via the greater sciatic foramina inferior to the piriformis muscle. So if you see here, what is the root? The L4 to S3 is the root value of the sciatic nerve. Okay. Now this nerve is formed anterior. It is formed anterior to the piriformis muscle. It is formed anterior to the piriformis muscle. Okay. And it will leave the pelvis via the greater sciatic foramina inferior to the piriformis. So superior to piriformis was superior gluteal nerve. Inferior to piriformis are two nerves. The inferior gluteal nerve, okay, the inferior gluteal nerve. This is the inferior gluteal nerve, inferior to piriformis, as well as the sciatic nerve. So sciatic nerve is formed anterior to the piriformis, but it will leave the greater sciatic foramina and it will enter the gluteal region inferior to the piriformis. So two nerve from inferior to piriformis is the inferior gluteal nerve and the sciatic nerve. Okay. Now we'll see the functions. The motor function, we'll see what is the function of the tibial component. It supplies all the muscles in the posterior compartment of the thigh. So you have done this nerve in detail when you have studied about the lower limb. So the nerves which are arising from the posterior, the muscles which are arising, which are present on the posterior compartment of the thigh is supplied by the tibial component of the sciatic nerve. And which are the muscles? This is semimembranosus, semitendinosus and long head of biceps femoris. So this muscles of the posterior compartment of the thigh is supplied by the tibial component of the sciatic nerve, except the short head of biceps femoris. So long head, semitendinosus and semimembranosus is supplied by the tibial component of the sciatic nerve. Okay. This nerve, the tibial component, it also innervates the hamstring portion of the adductor magnus muscle. Additionally, all muscles in the posterior compartment of the legs and soles of the foot is innervated. So this is the motor function of the tibial component. This you have to remember. It is supplying the posterior compartment of the thigh muscles, which includes semimembranosus, semitendinosus and the long head of biceps femoris, except the short head of biceps femoris. It also innervates the hamstring portion of the adductor magnus muscle. Additionally, it supplies the muscles in the posterior compartment of the legs and the soles of the foot is innervated. So this is about the tibial portion or tibial component of the sciatic nerve. Now we'll talk about the fibular component. It innervates the short head of biceps femoris. Long head is innervated by the tibial component. Short head is innervated by the fibular component of the biceps femoris. And all muscles in the anterior and lateral compartment of the leg and also extensor digitorum brevis muscle. So fibular component is supplying the muscles of the anterior and lateral compartment of the thigh, and posterior compartment, okay, is supplied by the tibial component of the sciatic nerve. Now anterior and lateral compartment. First we will see the lateral compartment, the fibularis longus and brevis. And anterior compartment is tibialis anterior, external digitorum longus, extensor hallucis longus and fibularis tertius, that is peroneus muscle. Okay. So all these muscles are supplied by the fibular component of the sciatic nerve. Okay. Short head of biceps femoris, long head is supplied by the tibial component. Okay. And anterior and lateral compartment of the leg. Okay. Also extensor digitorum brevis. So lateral compartment fibularis longus and brevis muscle. Anterior compartment tibialis anterior, extensor digitorum longus, extensor hallucis longus and fibularis tertius, that is peroneus muscle. Okay, so this was the motor function of the sciatic nerve. We'll go to the sensory function. The tibial component, it innervates skin on the posterolateral surface of the legs as well as the sole of the foot. So this you have to remember again. The sensory function of the tibial component of sciatic nerve means it is providing senses to the skin, and where? On the posterior and lateral surface of the legs as well as the sole of the foot. The common fibular component innervates the skin on the anterolateral surface of the legs and the dorsal aspect of the foot. Okay. So the sensory function, tibial component and fibular component. Tibial component is skin on the posterolateral surface of the legs as well as the sole of the foot, and fibular component innervates the skin on the anterior lateral surface of the legs and the dorsal aspect of the foot. Okay. So I'll continue the next nerves, the remaining nerves in my next video. Thank you, students.